Hi guys and welcome. So we're going to cover asthma as well as some of the other COPDs. So asthma is considered an obstructive disease. So is chronic bronchitis and emphysema. So let's start off simply by describing disease states that we're going to talk about today. So I remember it best by ACE. Even though your textbook and a lot of people will say, oh, it's chronic bronchitis and emphysema that are considered COPDs. Yes, that's true. However, all three of them are considered obstructive diseases. So I like to group it together. That way it's faster and easier to remember. And I just remember ACE as the three that will need to deal with this. So this is the airway. This is the diameter of the airway that passes through and allows the passage of oxygen into the alveoli that then allow crossing or exchange of gases, right? There's three components to this disease and three problems we have to deal with and manage. So the first problem is bronchoconstriction. So bronchoconstriction deals with constriction of smooth muscles or contraction of smooth muscles within the airways that reduces the airway diameter and decreases the amount of airflow that can get through. So bronchoconstriction, first one we have to deal with. Second problem that we have to deal with and manage is mucus production. So we're going to keep mucus down there because there's really no drug that we would give to deal with the mucus. What we look at for mucus production is maybe giving fluids, hydrating to ensure that it keeps the mucus nice and thin. And the third one that we have to deal with is inflammation. So what are the signs of inflammation? There are 4 signs of inflammation. The 4 signs are herpes, heat, redness, pain, and swelling. So we have 1, 2, 3 problems that we have to manage. The first problem, let's do that because that's one of the easiest ones that we've reviewed many times with autonomics. So we have the gas and the brake, right? We said the gas, how many lungs do you have? You have 2 lungs, right? So you have beta-2 receptors found in the lungs, and they cause, when you stimulate these receptors, they cause relaxation and dilation of the airways. So let's stimulate the gas. Let's step on the gas. And the other thing we can do is take our foot off the brake. So stepping on the gas, we call it beta-2 receptor agonists, right? So beta-2 stimulants, beta-2 agonists are epinephrine, shortest acting, immediate acting, but doesn't last a long time. So you can't really use that outside of the clinic. It might be the thing that starts to open up your airways. Some people try and get it over the counter. It is available, used to be available as Primatene Mist. I think some places still have it, but best thing to do is go to the emergency room so you can get your Albuterol. Albuterol is your emergency inhaler used to open up the airways immediately and keep them open for a little bit longer than what epinephrine would do. The last one is salmeterol. Salmeterol is a component of long-acting, it is a long-acting beta-2 agonist, and it's a part of Advair or even Ceravent. With Advair, it's in combination with another drug, corticosteroid, which is an anti-inflammatory. But epinephrine, albuterol, salmeterol, that's like stepping on the gas, right, to open up the airways. Well, if I step on the gas, I can also take my foot off the brake. So taking your foot off the brake is like using a muscarinic blocker, which is also known as an anticholinergic. Anticholinergics like ipratropium bromide can be used in combination with your beta-2 agonist to do one of 2 things, to help maintain and keep the airways open as well. But muscarinics, when you stimulate parasympathetic receptors like this muscarinic receptor, it increases mucus production inside the airways. So a part of this component for using anticholinergics is that it reduces mucus production. Ipratropium bromide, muscarinic antagonist, opens the airways. But there's one more drug. These are called methylxanthines, and we're going to just call them stimulants. They're similar to caffeine in nature. They increase what we call cyclic AMP. Cyclic AMP is, when I increase cyclic AMP, it acts as a stimulant to turn on different pathways inside of the cell. So these methylxanthines, like theophylline, theophylline is a methylxanthine similar to caffeine, in terms of the effects. So as a stimulant, it actually opens up the airways. But a side effect is it gets you nervous, just like caffeine. If you overdose on caffeine, think of the things that can happen with you. You might have GI effects, you might have seizures. Well, I mean, that's an extreme case, but you have, everything is elevated because it's a stimulant, right? So you open up the airways, your heart rate might be up. So there's a lot of side effects that can be associated with theophylline. So we have 1, 2, 3 items. We said mucus production, pretty much fluid hydration. And let's do anti-inflammatories. So there are 4 major anti-inflammatories that I want to talk about. The first one is what we